Hello and welcome to your new Commissioning for Value Focus Packs. I'm Matthew Cripps and I'm National Director of NHS RightCare. This short video will help you to work through the pack, highlighting key points and explaining what the data is showing. This collection of focus packs provides more detailed information for local health economies on the highest volume programmes of care that were covered in your Commissioning for Value Refresh Pack published in January 2016. The focus packs include a range of process and outcome measures and information focusing on the most common procedures and diagnoses for which your patients are being admitted to hospital. These measures span the whole of the pathway from primary prevention through to the end of life and facilitate local optimal pathway design and improvement. Commissioning for Value is part of the RightCare programme and approach. The RightCare approach aims to help local health economies prioritise the programmes of care that offer the best opportunities for local population healthcare improvement. By providing you with data, evidence, tools and practical support around outcomes, quality and spend, RightCare helps you to transform the way care is delivered for your patients and populations and therefore helps you to reduce unwarranted variation. Please take a look at the video, and if you need any more help, then please do contact us via the email address at the end. Thank you very much.
This focus pack provides information on musculoskeletal conditions and trauma and injuries. The pack is a real pack, but we have redacted the name of the CCG. We will make you aware of where we have reduced the amount of slides in the pack for the purpose of this short video. Page 9 provides information on the similar CCGs that are used as the basis for comparisons in the pack. These CCGs are selected based on demographic factors such as deprivation and age of the CCG's population. In January 2016, we published 2 pathway on a page charts, one for musculoskeletal and one for trauma and injuries. In this focus pack, there are now 4 musculoskeletal pathway on a page charts and 1 for trauma and injuries. For the purpose of this video, we are only showing 1 musculoskeletal pathway, the osteoarthritis pathway. The chart here presents a range of indicators from across the patient pathway. Bars above the 0% line mean that the CCG value is higher than the average value of the 10 similar CCGs. For some indicators, a high value is good. For some, a high value is bad, and for some, it is not clear-cut. For example, the 5th and 6th indicators here, the rate of hip and knee replacements, are shaded blue because local information is required to determine what the appropriate rate of treatment should be. Non-elective expenditure is shaded red because the CCG has a higher value than the average of similar CCGs, and this is considered to be bad. For the health gain indicators, a higher value is good, so these bars are shaded red because the CCG has lower rates of health gain. However, this is not totally clear-cut either, as the pre-treatment health status should also be considered alongside the health gain. This will be demonstrated later. The final indicator is emergency admissions for hip replacements, and this is shaded green because the CCG has a lower value. But it is important to note that the confidence intervals here are very wide and cross the 0% line for this indicator. So the CCG is not statistically significantly worse than the average of similar CCGs. This next page repeats the trauma and injuries pathway chart that was included in the Commissioning for Value Where to Look packs published in January. The next set of pages shows spend on hospital admissions for musculoskeletal conditions broken down by elective and non-elective admissions. For trauma and injuries, the elective and non-elective spend are combined. This page shows musculoskeletal age-sex weighted spend per 1,000 population for the CCG and the average of the lowest spending 5 CCGs of the similar 10. Note that this is a different comparison to the pathway on a page, which compared the CCG to the average of all 10 similar CCGs. So here the CCG could save over £1 million a year if it moved down to the level of the 5 lowest spending similar CCGs. Although the majority of the CCG spend is elective, the bigger potential opportunity is for non-elective admissions. The CCG has a potential opportunity of £810,000 because it currently spends almost double the rate of the lowest spending CCGs for non-elective admissions. Please note that elective admissions are considered to need local interpretation in a similar way to the hip and knee replacement levels discussed earlier. This next page breaks down the spend in more detail, for example osteoarthritis and back, neck and musculoskeletal pain. Page 59 shows a scatter plot of the pre-treatment health status and health gain for knee replacements. This shows that CCGs with a higher pre-treatment status receive lower health gain. The yellow diamond here shows that this CCG receives lower health gain than most CCGs with similar pre-treatment health status. There now follow spine charts providing information on risk factors, prevalence, activity, spend and outcomes. For the purpose of this video, we have only shown one, but the full set of charts is in your packs. This page includes the spend indicators. The spine chart shows the values for the CCG for each indicator, and the yellow dot shows where this falls in the distribution of all CCGs in England. That's the white space in the chart. The light green bar shows the range of values for the similar 10 CCGs. The second indicator down here is elective spend for all musculoskeletal admissions. The yellow dot in the middle of the range for similar CCGs. The best lowest 5 opportunity box shows the opportunity figure of £506,000 seen on page 18 that the CCG could achieve if it could improve to the level of the lowest spending 5 similar CCGs. This is shaded blue for local interpretation. The indicator below is non-elective spend for all musculoskeletal admissions. Here the yellow dot is to the left of the green bar, showing that the CCG has higher spend than all of the similar 10 CCGs. The blue diamond shows the level of the best 5 CCGs, i.e. those with the lowest spend on non-elective admissions. The best lowest 5 opportunity box includes the figure of £810,000 from page 18. This is shaded red. The similar 10 best box names the CCG with the lowest rate of spend for non-elective admissions in the similar 10. The green triangle shows the value of the best CCG in the wider cluster, which is included as a stretch target for those CCGs who are already performing well. The darker green bar to the right of the yellow dot shows the worst performing 2 CCGs in the similar 10. These features are not included for the elective admissions indicator because this needs local interpretation, so it would not be right to denote best and worst CCGs. There now follows pages showing more detailed information for all the indicators that may be red or green. For the purpose of this video, we're only showing one, but the full range of pages is in your pack. Page 88 shows the non-elective spend indicator for musculoskeletal admissions already discussed. The value of £810,000 is repeated in the title line and is shaded red, and the top bar chart shows all CCGs in England with the CCG bar in yellow and the similar 10 shaded grey. The bottom chart shows just the CCG and the similar 10. The horizontal blue line here is the level of the best 5, which is where the CCG would need to move to in order to save that £810,000 a year. The length of this video means that we're unable to go into full details about all the elements in the pack, but page 145 shows how to get further support if you require assistance interpreting these packs. This includes a link to the website where the data used in the packs, a metadata file, and an interactive tool will be placed. Thank you.